I commend the proposition. In fact, I have it included in a recently published health document that ye yourselves in Nursing Home Ireland argue for a forum on long-term care. I think that that is an absolute essential, looking at all of the specific needs, the needs of older people in the home, either in tandem with a partner or other family members, living alone, and the specific supports that are required. And then in the situation where it is no longer either appropriate or safe, where an older person requires care in a long-term residential setting.
A forum, yes, I would be in favour of a forum. The difficulty I have is that the HSE, and I'm not saying I'm detached from the HSE, I'm not, because clearly we are all part of the one agenda. The HSE would say to me that you can't have just one particular group in terms of this long-term care who are, and you've heard the argument yourself, who are at the table when there aren't others at the table.
No, but stakeholders forum, stakeholders plural includes the Nursing Homes Ireland, but it doesn't. Yes. It doesn't exclude others.
No, but I think that the way it's structured now, there is an exclusion going on, because clearly the HSE, who are the people that run the public system, are constantly at the table. But I think we should have a stakeholders forum. But I'm not certain that it should be in terms of developing policy. I hear what you're saying in terms of input and whether or not that voice is heard in order to ensure that it happens. But the other people I believe should be at the table would be, in fact, the hospice movement and people like that. And I do believe that should happen. But
let me just check on Fine Gael. Regina Doherty, do you think there should be a stakeholders forum?
Well, there's always a benefit to listening to people that are actually running the business. But actually, I totally agree with what Kathleen has just said. There isn't, the nursing homes, be it private, are not the only sector in the provision of care for older people. There's probably about 5 or 6 different bodies, and they all need to sit around so that we all need to see which piece of the pie that everybody is contributing to and the gripes that people are experiencing.
Of course, there's merit in it. I mean, look, being quite honest, I mean, nobody in this room or those that are not in this room in the public sector can provide the capacity that we need in the years ahead to deal with the crisis that we're facing. We can't deny that there's not going to be a crisis in terms of healthcare and pension provision. And if we decide to go down the road of providing it all in pension, well, then we're going to have a difficulty in providing healthcare, and the quid pro quo is the case. So there has to be an ageing strategy across all sectors.
So you say there's merit in the stakeholders
absolutely,
forum.
and
there's merit in a lot of things, but would you commit to supporting it?
Yes, I would, and I've spoken to Dáil in that context, that we do need a forum to address all these issues.
Catherine Murphy, just on the stakeholders forum, do you support that?
Yes, in actual fact, I think far too much public policy is made in an internal way. And in actual fact, I think that we have got to be much more inclusive in the way we actually do things into the future across a range of different policy perspectives. I would tend to favour the public if in an ideal world, and let me say that. But I completely accept that the private sector is carrying a huge load in relation to the delivery of this particular service. And when you talk about stakeholders, I would very much include people who have been recipients or families of recipients of service in any kind of a stakeholder forum, because at the end of the day, they have a different perspective and an important perspective as well. We realise that, and we can see the demographics in relation to the ageing of our population, and there's going to be an increased level of dependency. That's where we've got to factor in the evidence-based approach. It doesn't make good sense for people to be in acute hospital beds when they can't go home and do require care. So that's where obviously the challenge of how you make sure that that is available to people, and not just and how you make it as efficient as possible.
Through Nursing Homes Ireland. I have in fact asked for a review of the NTPF on the basis that it should be, I suppose, the level of care that the individual gets rather than where the nursing home is located, and that geographic funding is ridiculous. And I've asked them to look at that, and they are looking at it at the moment. I actually had it included in terms of the review of Fair Deal, and that is being looked at. But I do think that we're at the point now that it has to be about the level of care that the individual needs within the nursing home rather than where the nursing home is located or what the fee is set for a particular region. I disagree with that. I think it's ridiculous, and that is, it's not that we don't know about it, again, through your own organisation, and we have in fact asked them to look at that and come back to us with some suggestions, because we realise that that type of system really is not sustainable into the future.
There is now a disincentive for any
Yes.
owner of a nursing home to take somebody who manifestly needs care,
Yes.
because the cost to them
Addition-
is going to be
And
so
for-
high in
and-
terms of staffing.
Unfortunately, they don't. You know, anyone that approaches them, it is my experience that their doors are open to everyone. But it is a disincentive and something that is unsustainable. And we have, during the review of the Fair Deal scheme, I've asked them to take a specific look at that. They haven't come back to me yet, but I think it's something that will have to happen, and will have to happen very shortly.
On the issue of investment, look, I said at the outset, I mean, I don't expect or see that the state can actually, on its own, provide the additional capacity. So it requires a partnership with the private sector. And in doing that, I don't expect the private sector to be able to invest without there being a return. And it is to get that balance between the profit that is required to fund that investment.
It's funny that in this discussion, a phrase that is employed frequently in relation to health matters has not been used. The money follows the patient. And when you think of the what is at the core of that statement, for each and every one of us, I see no difference. We have to address capacity, standards not only of accommodation, but critically of care. So the individual, and we all are, the complexity of our particular needs, the level of dependency. In my own exposure to the personal, and from time to time my visits to the nursing home facility, I have seen with my own eyes and have become acquainted with them, friends with other families whose level of dependency and the complexity of their loved ones' needs are much greater than my mother's. And that's within the sector that you represent. So I can say firsthand that the point you're making is absolutely valid. You're providing the same comparable level of care within your respective settings as the public sector does in theirs. I think it is very, very important that the assessment is done in relation to the needs of the individual. There will be additional needs, requirements, and thereby the requirement of greater provision, greater financial support in specific instances.
The review of fair care, or the Fair Deal scheme, is obviously very much needed, and it has evolved over the years. And I think obviously everything that's been said in this room is warranted, and it does obviously bear the reality of the fact that you do feel undervalued. Excuse me. But now that the review is happening, that doesn't necessarily mean that there'll be more money, but there definitely has to be transparency in why you're getting paid, what you're getting paid. You're not getting paid the same for two people, but you are at the moment, even though the care needs of those two people are not the same. So I think the review is very much needed. And actually, I think it should feed into the forum, because it shouldn't be a fait accompli that when the review has happened that we decide that this is what's best for you and take it or leave it. It should be, this is what's the review has shown up, and how do you feel about it, and maybe let's sit down and talk about it in exactly the same manner as we've done over the last years with our GPs and the IMO and the NHI with regard to the under 6s and over 70s care. So it's a two-way relationship. And I can tell you, and okay, I'm not a minister and I'm certainly not in any department, we do value what you do.
which, whether we like it or not, or whether you like it or not, is the system that's presently structured, has to accept that there is a fundamental need to try and ensure that people have a choice about where they stay. And clearly the home care system that's in place is stretched, is underfunded and under-resourced. And not a political point, it has been. It is one that has to be really beefed up over the next number of years. And look, we are talking about an increase of about 8,000 beds between now and 2021, just to deal with the ageing demographic itself, as is evident and coming down the track. But the broader issues too, like we talk about investment, we have to stimulate and activate investment in the private sector, and of course there's a few ways of doing that, and some of them may not be palatable or popular. But I mean, clearly, private sector will invest if there's a reward in it. Let's be honest, they will invest if there's a reward in it. And I think that the public sector as well has to accept that. It needs to be more efficient, it needs to be more streamlined, it needs to be huge investment in the areas of regulations themselves. I mean, we are in breach across most of our public nursing home beds. I would say, 80 or 90% wouldn't meet the criteria that's presently laid down, and I know there's an exemption on that, but at the same time there needs to be a full requirement to invest in that. So what I'm saying, John, is that it requires huge resourcing. It requires long-term thinking, and that sometimes is not always evident from the political system in general because of our political cycles. But the population, the demographics, the changes in that are all very welcome. It also shows a positive trend in the sense that we're living longer and ageing better. Essentially,
we would favour, that we switch care away from acute hospitals into the community, and indeed, that's where the nursing homes will play a role, whether they're private or public. We believe that you need to take an evidence-based approach, and indeed that's something that you've highlighted in your own letter back to me in terms of today's event. So I think we've got to look at it in a holistic way, and it's not just a question of looking at. You've got to look at elements like housing and sheltered housing in addition to the like of nursing homes as an option, because going home may not be the right setting for the individual either. So I think we've got to look at the whole of life approach and have life cycle housing built into that.
It is very, very important that we affirm and recognise the direct participation and the future participation of the private and community sector in the provision of long-term residential care along with the public model. We believe that it is critically important, and that if the opportunity were there to play a direct part in the formulation of government policy post the upcoming general election, I believe absolutely, personally and on behalf of my party, that engaging with those who are at the coalface of service delivery is an essential in working out the pathway forward.
For me, I think the two things that are important today is, number one, to hear your commitment to the sector and to the provision of services, but also for you to hear our commitment. And I don't think that's just a Fine Gael thing or a Labour thing. I think it's a cross-party thing, that we do value what it is that you do, and I think it's up to us to make sure that we show that in any future negotiations or reviews of, number one, of the Fair Deal scheme, number two, of how the treatment and the negotiations happen with your the NTPF, and more importantly, obviously, how we're going to expand the entire sector and to make sure that there's cross-communications between the end-of-life people, the nursing home supports, be it private or public, the home care sector, and the healthy independent living sector, and the rest of the population, 80-85% of people who are still happily living in their home and healthy and in goodwill, and making sure that we're all in unison with each other. So I think that's the commitment that I've made in my head today, is to come back with it after the election.
Kathleen Lynch.
Could I start by thanking you for the invitation? I suppose in terms of the nursing and the registration, that is something that I wasn't aware of. I was aware of all the other issues that are surrounding it. But the one thing I think we need to be very, very clear about is the fact that whether private or public, the taxpayer pays. One way or another, it's the taxpayer pays. And I suppose that fund, that payment into the future is something we have to be realistic about as well. And as governments, we have to be realistic about it. 20% of the beds occupied at present are in the public sector. 20%. The rest are in the private sector. I think that should tell you that we cannot do this without you. It's that simple and it's that straightforward. It is very much a partnership approach that we have to take into the future. And I would say as well, and I think it would be remiss of me not to say this before we go, Fair Deal has been a success. It has been an enormous success, especially for those who need your services, especially for those. Now, there are things in relation to the NTPF and individualised care and all the rest of it that we have to look at. But it has been a success because I remember a time, I'm old enough to remember a time, and I see one or two around there who are as well, old enough to remember a time when in fact people couldn't get into a public nursing home because that's all there was. And I equally remember a time when I would have people who had private nursing facilities who would ring me up and say, you have a family in your constituency, we've had their mother for the last 6 months, they can't pay, we're out of pocket, what are we going to do? And I would have worked on both sides of the fence, trying to get them their money because they needed it to run a good service, and equally to try and find a space for the person who needed that long-term care and whose family couldn't do it. So Fair Deal has been a success, but like all success stories and like all stories and all systems, it needs tweaking. And that's really the next big task. But the notion that you would even contemplate that you are not a vital part of what we need to provide both now and in the future, when you look at the figures, 20% public, 80% private, clearly, the need exists and you are fulfilling the majority of that need. So my commitment to you is that we will press on with the review of the NTPF. I'm telling you that now, I will do that, committing. And most definitely, now that we have a nurse sitting at the table as a director in the HSE for the very first time, Siobhan O'Halloran, and whom I believe she believed had resolved the issue, I will be going back to her this afternoon to find out exactly what else needs to happen and what we can do about that. But thank you for the invitation.
Thank you very much, Minister.